I'm sitting with Danit. She contacted me relatively recently saying if she could come down and meet me, as she wanted to chat with me. She was also wanted to, I think, well, could I say, air your grievances? That means speak out.
Yeah.
I think we're saying this these days, and we have this word we call sharing, don't we?
Sharing, yeah.
You want to share your experiences.
I want to share, yeah.
Yeah. And so I'm going to take some time, we're going to sit down, we're going to record this, because Denise very kindly said she would share this online so that other people could learn and possibly would find similarities in their own situation.
Yeah.
Because I think a lot of people would. A lot of people are contacting me, and a lot of people are having problems, various different problems, and I'm trying to work out how this relates to orthodontics. This is this constant recurring theme that people seem to think that these problems are related with orthodontics, and I have suggested a pathological process by which they could be related to orthodontics. Mm-hmm. So I'm trying to piece it together by talking to people, by clearly looking at research, but also listening to people's personal stories.
Yeah.
And that's what you bring to us.
Yeah, my story, it was a long time ago. I'm 33 now, just turned 33. I was 15. I never thought of having braces, but it was in fashion in school. Everybody had braces, and they would have come to class with like this colored
elastics.
Yeah, the elastics, and it was like, and I was like, okay, why don't I have one? And then I went to he was like the most famous orthodontist in Israel, one of the best, and he was treated my whole school, like literally everybody. So I said, okay, why not? My parents said yes, and then I went to an appointment, and he was saying, okay, I'm gonna have to do the X-rays, and then we made another appointment, and then he said, you have a missing tooth, the canine, the upper canine from the left side. And I was shocked because I had no idea. My parents had no idea. And my parents
your dentist hadn't picked it up at this point?
Yeah, at the age of 15. This is, I was shocked because, I had treatments before and nobody could see. I had how do you call it? In here. I had a hole.
You had a gap?
No, I didn't have a gap.
Did you
I have a hole because I had a sweet tooth. So I had a hole in here. So the patient, the doctor who was treating this tooth couldn't see that I had no canine. This is ridiculous. So they didn't pay attention.
Yeah.
And I was shocked. It was so close. And yeah, so I decided to. He suggested me, okay, you can do a brace. You can do the braces. There is a thing that we can do a treatment. We can create a gap. We can make a surgery. We can bring the canine and just pull it and bring it back to the place. I had a friend who, had a similar case to mine. He was very successful. Of course I'm going to do it because they scared me that it's going to come out in 20 years, 30 years, nobody knows. I said, of course I'm going to do it. No question about it. So, okay, so I started the treatment. It's been 4 years until the age of 19. And at the beginning he created a gap. And he expanded my upper jaw, my maxilla.
Did he use that with a removable appliance, or did he use that with the fixed appliance?
He put the expander up my jaw, connected with the back teeth, 2 and 2.
Yeah.
He had to remove 3 teeth overall.
Okay, so
overall I'm missing overall teeth,
Yeah.
like including the canine. He removed 4.
So he removed the canine?
He removed 3. No, I'll continue with my story.
Okay.
So he wanted to create more space, in order to create more room for the canine to show up.
Yeah.
So he put like a metal kind of thing through to connect the rest of the teeth, and I had like a gap in here.
Okay. So
he opened a space for the upcoming canine.
Okay. So this is, when you're saying a metal thing.
It was like a chain.
There was a little metal chain glued to the tooth. So did you have surgery to have the tooth exposed?
Yes, and the
so you
surgery.
Went to see a surgeon.
Yeah.
And it would be usual the surgeon would put the little, it's literally a gold chain.
No, the chain that I had, because this one was like I had a gap, so I didn't want like anything to come against it or whatever. So I had like connected these teeth, like just a chain.
Like but like the fixed braces.
Yeah.
Yeah.
Something like that. I had braces all over. He created. He used the rapid expander to create more space to.
So he did the rapid expander first.
I believe so. Yeah.
Okay, and then he put braces.
Yeah.
Yeah. And then when you're saying he had a little chain, was that this elastic chain?
Let me make it clear. Sorry for my English once again.
That's okay.
I had braces. Okay, took some teeth out from the upper and from the lower jaw, and then I had the expander. I had it for like a few months, few good months, and I had this tool. He called my parents and he asked them, okay, you're gonna do like, I think it was twice a day.
Yep.
It was twice a day.
Yeah.
Morning and evening.
This is the activation.
Yeah, this is the...
Yeah, I know them well.
The devil, because this thing, it hurts. For me, it was like, I was crying while my mama was doing
So if you're doing 2 activations, that would be depends on the particular screw they're using, but that would be 0.4 millimeters plus 0.4 millimeters, so that would be 0.8 millimeters a day.
Yeah, it was like for about 2.5 weeks, every day, twice a day.
Yeah.
Something like that. It wasn't less than 2 weeks.
Yeah. It goes well.
And then I got a gap over here.
Well, you've effectively split the 2 parts of your top jaw, so you ripped it apart. So one half goes one way, the other half goes the other way. You make the top jaw physically bigger.
Yeah. Then I had then he created this gap over here. Now I realized. Okay. It created a gap over here, and then he pushed in order to create space for the canine, for the upcoming canine. It was still on top of my jaw. He started to move these teeth like to the other direction to create like a space. Then I had the surgery of revealing my canine, and it failed. I'm not sure why.
When you mean it failed, what do you mean?
They said that the root of the teeth got hurt, so they cannot save the teeth. So let me just show you. This is from,
So this is an X-ray from, is that from 98?
98, yeah.
98. Okay, so
from the beginning.
What I can see with this canine is that it actually crosses the midline. So the tip of the canine tooth is actually crossing the midline. You're right, there's no tooth there. The tooth number 2 is touching tooth number 4. Interestingly, the angulation of these front teeth. All of these front teeth are tipped, aren't they? They're tipped slightly sideways.
And it was like narrow in here. They started to go like on top of each other.
You mean the lower teeth?
Yeah,
The lower front
just
teeth
a little
were
bit,
a little bit crowded.
like 3 or 4.
Okay.
Like.
Okay. So, having done the rapid palate expansion, they then did the surgery afterwards.
Yeah.
Yeah, that would be the normal sequence of events. Okay, then they tell you after the surgery that it was not possible to save the tooth.
Yeah.
So what happens next?
I was obviously really disappointed. My parents were in shock, but they never asked anything. Like, they accepted that. Okay.
Well, but you know, sometimes things happen, and it was a very difficult tooth.
I know. Yeah. Yeah. So I came back to my dentist. He was like...
Your orthodontist.
Orthodontist.
Yeah.
And he really wanted to see how I was. Like, how was it?
Yeah.
And I told him that the surgery has failed. And he was like really angry.
Well,
because he really expected it. Yeah, no.
He cares. He wants to do a good job.
He really cared, yeah. And he put a lot of effort in order to create the space, and he was with me, you know, together. So, plan B.
Yeah.
Plan B was to twist this tooth, the 34. Like the one after.
So the tooth in front or tooth behind?
Yeah, this one. He twisted it in order to look like a canine.
Okay, so he's taking the premolar.
Yeah.
He is going to make the premolar, so tooth number 4, look like the canine tooth number 3. So you'll do some dressing up.
Yeah.
Yeah. To make it look the same tooth.
So that's what we did. He narrowed the space back.
Space.
Yeah, and I still had the leftovers of the rapid expander.
Yeah, because they created excess space.
Yeah. It was like for a few months later, still there.
And then they did take other teeth out?
Beforehand.
So, okay, so you've already had teeth taken out.
Yeah.
So that it was balanced. Do you have a set of your models?
No.
The teeth.
This is before I started the treatment.
Okay.
You can compare it to what I have.
No, hang on. We've got the image here. This is before you started treatment.
Yeah.
And here you have present in your mouth. We have all of the teeth. All your teeth are present. The wisdom teeth haven't erupted, and the canine is buried.
Yeah.
All right. So you've got all your teeth present. Yeah. All present and correct.
Okay.
Now, when's this one here from? This is 2009. So when we look at this image here, you are... So your wisdom teeth have come in at the back. On the lower, you are missing a premolar on the lower left-hand side. Yep. Let me hold that up. On the upper 87654, you're missing the canine on the upper left, and on the upper right, you're missing a premolar. So you are down a tooth and you hang around. So 8765432. No, you're missing something down here. Okay, so you're now. Well, I don't know, it's difficult to tell on an X-ray exactly the tooth. It looks actually almost more like a canine tooth that's missing on that from the angulation of the roots, but that would be a very strange tooth to remove. But
this is me now.
It does look like it. That's you now.
A few months ago.
Yeah. Left. Oh, yeah. Let's get that the right way around. And that is. Yeah, taken 16, so that was taken the end of last year. And yeah, you're missing, looks like a lower left premolar, looks like a lower right canine, looks like an upper left, canine you're missing there, maybe it's a premolar. And of course the upper right sorry, upper right, and the upper left looks like you're missing a canine. Well, we know you're missing the canine because that's the tooth coming out. So effectively, they've taken out a tooth in each quadrant.
Yeah.
Yeah?
Yeah.
The tooth in each quadrant. You've got a set of models here.
This is me now. This is now.
This is you now. Sometimes, can I have a look at the models, possibly?
Yeah, there we go.
So we've got these models. So I can usually guess more from a set of models. No, you've still got the lower canine on both quadrants.
Yeah, the lower canine.
So in the lower, it looks like you're missing 2 premolars. The gums are a little bit low on that canine here. It's very low on that canine. In fact, very low on the other canine as well.
That is correct.
And it looks a little bit low down on the inside here all the way around, actually. Okay, so you're missing 2 premolars in the lower, and on the upper you're missing a premolar one side and a canine on the other side. And this has been built up to look. You can smile for me. Yeah, smile. Yeah, clearly you're a bit asymmetric. The canine doesn't look quite like a natural tooth.
Yeah.
Well, it doesn't look. The fake canine doesn't look like a normal canine, and it looks a little bit asymmetric on the sides.
Yeah.
So we just got to the point where realistically we were discussing which teeth you'd lost. He then closes up the space from the rapid expansion.
Yeah.
With the fixed braces that are on. And
he also used like elastics, like 3 years out of the whole process. I always had like elastic connecting my upper joint.
But were they vertical elastics or were they angled in a certain direction?
Angled.
Do you remember how they were angled?
I think the top one, it was like in this way.
Okay,
Top
so going back. Like this. So up at the front, forwards, at the bottom, backwards.
Yeah.
Okay? Was it the same on both sides?
Yeah.
Okay. All right.
And I also got this thing to wear for like 14 hours a day.
Did you wear it 14 hours a day?
No. Because I didn't want to wear it to school, and it was like really painful.
Okay.
And it was.
So you wore this all night?
No.
Most nights?
No, not really.
How many nights out of in the week?
Oh, like maybe 2. 1.
2. Okay. Well done.
I know.
I would have. This is. Yeah. I don't like this. Yeah, particularly this low pull one. It's referred to as cervical headgear, and this is a reverse pull headgear. Sorry, this is a normal pull. I'm using reverse pull, so I'm going in the other direction.
Yeah.
Clearly, there's headgear and there's headgear. This is the one I like the least. Okay, this is the one that people criticise the most. All right.
It's really painful.
Yeah, I can imagine. I don't do this to people.
And I'm not that gentle. I mean, I'm a survivor. I can suffer pain, but this was
tough going.
This was together with the rapid expander.
Those were the 2 bad. What about when they adjusted the braces?
Every month, I used to see him like once a month. I typically I used painkillers most of my high school.
Yeah.
Every time I would see him like once a month, I had massive pains. My head, I felt my head is going to explode. I had massive pains all over my face.
How long did that last?
The pain, every time that I would see him, it lasted for like a few days after.
Okay. So you were getting pain for a couple of days after you saw him each time?
Yeah.
Okay. And you would need painkillers for how many days?
A few days. I don't know, for like 3-4 days afterwards.
Okay.
And when I used the elastic on the sides that they gave me, like the special one.
Yeah.
It was like massively. It was like really painful.
But you were using the elastics most of the time?
I was.
Okay,
Yeah,
so you used elastics all the time, or
because
most of the time?
it was like, you know, nobody could see, and it was like easier. So
Yeah.
this one I did.
You just wanted to, but that was
Yeah.
uncomfortable.
It was.
But that was within your pain threshold.
Yeah.
So you didn't need to take painkillers for those elastics.
Oh, for these as well.
But that means you're taking painkillers all the time.
No, I didn't took all the time, but the elastics were like for I'm not sure for how long it was, but it was for like separate. You know what I mean? He didn't use the elastic all the time.
So you had periods of using the plastic.
Yeah.
And
Yeah.
when you were using the plastics, were you taking painkillers?
Yeah.
Okay, so
I remember that.
you had significant amounts of time using painkillers.
Yes.
Okay.
Yes, I remember that because I had to study and I was in pain. I remember that.
Yeah. But then, you know, using this amount of painkillers, you're going to have multiple trips to a pharmacy. You know, there must have been an issue actually just buying these painkillers.
It wasn't like that, but you know, I felt like my head is going to explode. Okay. I try to be patient with the painkillers. I took them, but you know, whenever it makes sense. You know, obviously my parents wouldn't allow me to take painkillers all day long.
Yeah.
But they knew that I was suffering.
Yeah.
Obviously, when my mama was twisting the expander, the rabbit expander, she saw me crying.
Yeah. Okay, so now let's continue with the story.
Yeah.
Was there much more in that? You complete what happened with the orthodontics. Is that most of it?
This is the most of it. Yeah, he tried to create like fake canine. What else? All I know is when I finished the treatment, everybody in my school, they used to take like a picture and to hang, you know, in the clinic. So I didn't want to take a picture because I wasn't happy with the results.
So you weren't happy with the results?
Yeah, because I said everybody's smiling and they look okay and they have like pretty beautiful teeth, and mine were like my upper teeth. I don't think that. Can you see them? Like really?
Well, yeah.
That's not a fancy smile.
Well, yeah, I want to be very balanced, right? Yeah. Because, you know, in medicine, not everything goes well, does it?
I know.
Yeah? Mm-hmm. You know, clearly this orthodontist you saw has got lots of successful results. Mm-hmm. Clearly.
Yeah.
You know, and, you know, we'll all have the odd result that doesn't go well, and unfortunately that happened to be you. Mm-hmm. And you weren't happy with the result at the end.
Yeah.
Talk a little bit about this.